Hello and welcome to Wellness Wednesday. I'm James Currie with the Communications Department here at MCHD. Talking to Dr. Ben Linzmeier. He is at USA, which is the University of South Alabama, and we're going to be talking about Lead Poisoning Prevention Week, which occurs every year in October, correct?
Yeah. Starting yesterday, starting today, and going until
Yeah,
next week.
22nd, I believe,
Yeah.
is when it is. But we're not just going to confine it to one week because it is so
Mhm.
important. We like to draw attention to it, but it's something that people need to be aware of every single day, especially if they work in certain environments, which we'll kind of go into. Let me check my show notes here for just a second. So tell me a little bit about what you do there at USA.
Yeah, so I am a geology professor. So a good portion of the work that I do is actually studying fossils and things like that. But I've gotten involved in studying the distribution of lead in soils across Mobile, Alabama. So we study lead in soils using an instrument called an XRF. It allows us to measure how much lead is in a particular sample of soil. And we've been analyzing samples collected from parks, from community gardens, and then we've done these workshops where community members can bring their soils and have them tested. It only takes a few minutes. We don't charge anything. If you're interested in submitting your data to a broader research project that we're working on, that's great. If you don't want to do that, that's also fine. We're happy to provide the service for folks in the community.
Now, kind of a misconception, I guess, here is, when you talk about lead poisoning and prevention, people kind of get this picture in their mind. It's an old creaky house with peeling paint and something, that you don't go into very often, but, oh, kids stay away from the windowsills. But, it's much more than that, right?
Mhm. Yeah, so the reason, well, there are a few reasons that we're interested in looking at soils. One is that once lead ends up in soils, for the most part, it stays in soils. And so over the course of the 20th century, folks were using lead additives in gasoline, they were using lead in paint, and those things could end up accumulating in soils. And because they ended up accumulating in soils, they're still there in those soils. And so they can be remobilized. So you could have a house that you've built on a lot that did have one of those old creaky houses
Mhm.
that had lead paint, and that lead is still in the soil, and you track that soil in, and there's exposure from that pathway.
So there's a lot of different measures and steps that people can take. Say, for instance, if they work, excuse me, in one of these, you know, types of environments where it's a possibility that they could be bringing it home and exposing it to other people in their homes, right?
Yeah. So some of the industries or some of the jobs that are more associated with lead exposure today include, I mean, remediation work where you know that you're working with lead because you're removing it from houses. If you're an auto mechanic, you're exposed to more lead than average folks. Um, you can be exposed to lead with some plumbing jobs as well, depending on what you're doing in terms of solder, um, and some metal refining as well. And so the big thing to prevent exposure is really to sort of isolate the clothing and potential dust that you bring home as much as possible, so you don't accumulate that additional lead in your house. Where yeah, yep.
Yeah. So and also the exposure is exponentially worse for young children, right? There's all kinds of things like developmental delays that can occur and things like that, right?
Yeah. So the way that lead poisoning works, or uh, the consequences of lead exposure work, is that it can lead to things like you mentioned, like developmental delays, where you have something that is happening and it just causes issues with development, and then it's a permanent problem. Another reason that children are more exposed to lead, especially from sources like dust and whatnot, is largely because of sort of hand to mouth contact. And so they might, have dusty hands or have uh, paint dust hands and then put them in their mouths. And so that can increase their chances of having exposure to lead in that way.
And babies are a lot closer to the ground, right?
Yeah.
And they're
Yes.
crawling, so yeah, they're going to get into things. So yes, that it makes perfect sense that that exposure would be tied directly that way. Um, so if someone is curious about is my yard, maybe my home, how could they contact you at USA about getting a sample to you to find out?
So as of right now, you can email me, b Linzmeier at southalabama.edu, or you can keep an eye out for different sort of soil testing clinics that we've been doing with the county public health service. So we've done since April of this year, we've done 3 different clinics, and we're doing one this Friday. And we'll probably have more that we plan on doing in the months ahead as
Yeah,
well.
we certainly appreciate your partnership and being able to be the testing facility, obviously, for these samples, and to be the knowledge base on this side of it to help us out. Anything else you'd like to add about the week, or like we said, let's don't just contain it to just one week. It's something you need to be mindful about all year round.
Yeah, it's important for us to understand the distribution of lead across the city of Mobile, and by having information about the contamination of soils, not just at parks but in residential areas, we can really help to inform doctors, medical doctors as well, about where their patients might be at most risk of lead exposure from the soil pathway. And so by um, helping out by getting your own soil tested, you can contribute to this larger project, and you can also have a bit of peace of mind about some of the potential pathways for lead exposure. And one other thing I want to mention too is that if we do find high amounts of lead in different places here around Mobile, there are ways to help prevent additional exposure from soils. So there are different funding opportunities we've been looking into to help with individual folks working on remediation. But the biggest things that you can do right away are make sure that you have plants growing over the soil to prevent it from being kicked up when it's drier. You can add additional organic matter and additional soil on top of it to seal it in place. And then the most extreme thing would be removing the lead contaminated soil, but that's probably the most costly of it. Yeah, I think that's mostly or most of what I'd like to share. I can talk your ear off about this too, but it's a really important and impactful environmental issue, not just here in Mobile, but sort of across the U.S. And it's a great way if you're an undergrad at a university. It's a great way to help contribute to your community. If you're living in the community, it's a good way to sort of help yourself and help your neighbors understand your environment. So
Well, Dr. Ben, I appreciate you being on here, especially this week when we're talking about, lead poisoning prevention week. And, also just kind of some of the highlights of that information, and this can be found obviously too on social media and our website, the EPA website. Um, and, you know, just be mindful to of anyone that's curious, if they can just keep an eye out on our social media, then they can find out when we have these partnerships with USA to do these clinics. And like you said, there's another one coming up here at the end of the week. So it's just a couple of days from now. But
Yep.
well, thanks again for being on Wellness Wednesday with me here and talking about this important public health matter.
Thanks again for your time.